Good evening, villagers. Dr. Russ back here. And today I'm going to be speaking about some of the common medications for asthma and wheezing. Now, a lot of asthmatics, you probably have a ventolin inhaler, right? The ventolin inhaler is the blue inhaler, right? A blue and white inhaler, right? The puff, the inhaler. So, adults, you would shake up this blue inhaler, right? You put it in your mouth, right? You make a tight seal with your lips. You press it and you inhale. And most people would take 2 puffs. So you take 2 puffs, right? Let's say you are wheezing. You wait a while, right? Some people can repeat it, take another 2 puffs. You wait a while. You repeat it again, you take another 2 puffs, you wait a while. One of the big things you have to recognize if you are asthmatic, if you are using your ventolin, your beclotide, if you're using your inhalers and you are not getting better, you cannot breathe, severe wheezing, you check your finger SpO2, right? You check your finger SpO2 and you see this thing is starting to read in the lower 90s or less than 90, and you're using the ventolin puff, etc. You're not getting better, you're feeling short breath, you're feeling sick, come to hospital early, right? Our next medication that asthmatics tend to use is beclotide, right? Beclotide is the brown inhaler. This one is a form of an inhaled corticosteroid, a medication that reduces inflammation and helps to open up the airways as well, right? And it's usually given to a lot of asthmatics, right? So the combination of the ventolin inhaler and the beclotide inhaler, right? That tends to settle down the majority of asthmatics. Our next very important medication for asthmatics is prednisolone or dexamethasone. Now, prednisolone, it can come in small tablets, meaning you have like 1 milligram tablets or 5 milligram tablets. So a typical adult dose might be 40 milligrams, and that comes in a 5 milligram tablet. So if we do the maths, prednisolone for an adult is 5 milligrams times 8 tablets equals to the 40 milligrams adult dose. A lot of people, when you tell them okay, this is prednisolone, this is a steroid medication, you're using 8 tablets, 1 dose once for the day, they're like, steroid? Oh God, bodybuilding and steroid, they're good, and so much a tablet. Easy. Prednisolone is a safe medication, works really well for asthmatics, right? And it has nothing to do with bodybuilding steroids, right? It's a corticosteroid. It helps to reduce inflammation and improve your breathing. It works really well for asthmatics. There are other types, for example, dexamethasone, right? We can do a calculation, and a typical adult might use, let's say, dexamethasone 6 milligrams or so. If you come to hospital, we put up an IV, we'll give you hydrocortisone. So an adult might receive 100 milligrams or 200 milligrams IV, right? If you really cannot swallow, or if you're that severely wheezing, right? Now, just a reminder, and I always emphasize this, if you cannot breathe, if you are wheezing very badly, you're feeling very sick, chest pain, fever, foot swelling, right? Consider other things. It might not just be a simple asthma attack, right? Please consider an early checkup, right? Please consider an early checkup. If you cannot breathe, get a checkup. Severe wheezing, get a checkup. You're using your ventolin, your puffs at home, you try self-medicating, but you're not getting better, you get yourself checked up. Look out for the elderly. Look out for small children. If you see this child has noisy breathing, the chest sucking in, the belly moving in and out while they're breathing, they're looking very weak or run down, the heart rate very fast, right? The child has a high temperature, consider an early checkup, right? So again, always have on standby your ventolin or your beclotide as prescribed by a doctor, right? Feel free to drop a question down below about ventolin, beclotide, prednisolone, right? I'll try my best to reply. This is Dr. Russ signing out. You all keep safe out there.